What is the National Wound Care Strategy Programme? Here's how Medi UK uses the programme in partnership with healthcare providers to assess and treat chronic wounds and reduce patient suffering. Chronic leg wounds are a cause of profound patient suffering, but there is currently little consistency in the UK for wound care services. The National Wound Care Strategy Programme aims to improve standards of wound care delivered in the UK by addressing both patient care and healing rates, and reducing the time and money wasted on inappropriate and ineffective treatment. Medi UK's 3 simple steps for successful treatment can optimise healing and reduce the burden of wounds for patients, carers and healthcare providers. A patient has an ulcer on his lower leg that is slow to heal. Firstly, immediate and necessary care must be provided, and the patient on his initial visit should be checked for red flags, like a hot swollen leg or foot, suspected arterial disease, suspected blood clot or signs of skin cancer. These are thoroughly monitored, and if identified, the patient should be immediately referred to the relevant clinical specialist. If no red flags are present, the wound is cleaned and light compression applied in the form of Duomed Soft. Now let's take a look at the 3 steps in action. Step 1 is assessment. Within 2 weeks of the patient receiving immediate and necessary care, the cause of their leg and foot ulceration should be identified, and arterial insufficiency must be ruled out in order to progress to the second step of the programme. medi ABPI-MD is used to assess arterial supply to the leg and foot, and UCS debridement cloth used to gently clean and debride the wound. The second step is heal. Lower leg wounds come in many forms, and so too do the available treatments, like leg ulcer kits and wraps. Depending on the ABPI assessment, our patient can be offered compression hosiery of a minimum of 40 mm of mercury as a first line of treatment. The Mediven leg ulcer kit offers 2 layers of 20 mm of mercury compression and is proven to be both clinically and cost-effective to use. If the leg is swollen, a poor shape, has a lot of exudate, or the skin is fragile, consider using the Juxtalite wrap with its unique built-in pressure system. Step 3 is prevention of recurrence by continuing with strong compression therapy, using products like Mediven Active, Mediven Mondi and Mediven Plus, and reviewing the patient every 6 months. The risk of recurrence is reduced dramatically. All of Medi UK's products support patient self-care, allowing our patient to manage his wound and healing process safely and effectively at home. By following this simple 3-step process in conjunction with the National Wound Care Strategy Programme, together we can improve the care of patients with chronic wounds.